This edition of the Well Aware podcast features Dr. J. Craig Allen, board-certified addiction psychiatrist and vice president of addiction services at Hartford Healthcare. Tune in for a wide-ranging, insightful conversation between two experts in addiction treatment that will expand your knowledge of what's possible in behavioral health. Let's get started.
Hello, and welcome to the Well Aware podcast. Good to see you again. I'm Dr. Lauren Grawert, Chief Medical Officer here at Aware Recovery Care. And today I'm so excited to be joined by a friend and a very respected colleague, Dr. J. Craig Allen, who is a leading voice in addiction treatment in Connecticut. Now, Dr. Allen is a board-certified addiction psychiatrist, as well as a general psychiatrist, board-certified, and board-certified as a child and adolescent psychiatrist. So basically, he's like three doctors in one, which is super cool and super unusual. He is also the VP of Addiction Services at Hartford Healthcare, and he sits on several state and national level boards that are involved in advancing policy related to addiction treatment. He's also a very experienced educator, mentoring and formally teaching medical students and residents, and still finds time to actively treat patients. So we're so excited to have you today, Dr. Allen. Thank you for the time, and tell us, where does this podcast find you?
Well, this podcast finds me in my office at the Community Behavioral Health Center here in Meriden, Connecticut. And thank you so much for having me on. I think this will be fun.
Yes, absolutely. Well, let's dive into something we have in common, which is our work at Aware. You have actually been involved with Aware from much earlier times than me, really being a psychiatric consultant and specialist with Aware from as early as 2014. And can you just tell us a little bit more about that experience? Like, what drew you to Aware's in-home model, and how did your expertise kind of help shape the evolving model that we have now?
Yeah, you say 2014, and that was well after the diesel engine was invented and we were no longer using horse cart. But we did still have phones attached to the wall sometimes, I think, back then. What drew me to Aware was this huge gap that we had in behavioral health and in addiction services, which was for all of those people who all of the square people who didn't fit into round holes, or round people didn't fit into square holes. That was a huge number of people who had to choose between seeing someone out in the community at their office, going to a program 3, 4, 5 days a week, as well as trying to continue to live their lives and pay their mortgages and take care of their children, or even go away to a program where they would sleep and be completely separated. A program where the staff, professionals come out to your house or could meet you in the community and still stay connected to the medical experts and the people who can prescribe the medications, which can be so vital and life-saving. It was a no-brainer to try and be involved and work myself into that program. I worked with Aware for a long time in different ways. I was seeing a lot of patients from Aware up until just a few years ago. And it really is important to be able to offer a full menu to people who want help. And Aware was, for me, one of the first programs that actually did something that seemed so obvious, but also so helpful and innovative. And, so that's how I started with Aware and met some of the people that were involved in bringing it out of research, which was initially done over some research done at one of the universities here in the state, and then brought it to the community. And I just think that it was really a wonderful move. And since then, there's been many types of different innovations, although not nearly as many that have stuck. Not nearly as many that have stuck, and not nearly as many as one might think would be developed with disease that affects such a huge part of our population, not just the people directly, but families and coworkers and communities, et cetera, stuff that you know.
Yes. I think it's so hard to be innovative in a very, very highly regulated industry like healthcare. That things are often at odds. Innovation, new things in an industry, I would probably argue, is one of the most highly regulated and slow to change. So it is really nice we've been around a while, given that it's not an easy space to be innovative in, for sure. But we know for all the reasons that you just said that the in-home model is so effective for so many people, and yet it's not suitable for every situation. We know that there are degrees of clinical severity that really exceed outpatient level of care and require hospital and inpatient and residential levels of care. Now, you're the medical director of Hartford, which includes the Ridge Recovery Center. I could go on and on about how cool the Ridge is, but for you, what do you think sets the Ridge apart from other treatment centers when there's so many these days? What is unique and special about the Ridge? And what would you say is like the best kind of patient who's best suited for that type of environment?
Well, number one, please feel free at any time to go on and on about the Ridge. But Rushford runs 3 residential programs, a 3.5 over in Portland, Connecticut, 3.7, which is in Middletown, and then our newest program, which opened a little over a year ago, the Ridge, which is out in Windham-Willimantic line in Connecticut. That's the eastern part of the state. This was something that it was a long time in the making. It's in this beautiful setting, 60 acres up on the top of a ridge, which overlooks the trees and the beautiful countryside in Connecticut, used to serve religious purposes and still has the serene and the tranquil feeling when you walk the grounds, which is one of the things we promote. Nature therapy, certainly. We have privacy as needed, but also plenty of opportunity for engagement. All private rooms, our withdrawal management program, and detox program, as well as our residential program for men and for women, are all individual rooms with their own bathroom facilities, which is pretty important for someone who's very, very ill in very uncomfortable ways. But also, the staff and support is there. We have a holistic approach. We do sound healing and acupuncture, pet therapy. We have all of these different opportunities, yet we're part of Hartford Healthcare. And Hartford Healthcare is one of the largest healthcare systems in the state of Connecticut, cutting edge services in all specialties. And so being part of Hartford Healthcare, of course, we can offer state-of-the-art treatment for substance use disorders. We have an ACGME accredited addiction medicine fellowship program. So there are people who come from across the state and beyond, medical professionals, to learn from us. And so we have that unique blend of cutting-edge, evidence-based medicine and person-centered care, which understands the importance of family and understands the importance of good nutrition and sleep and physical activity and all of that try to sew together out there at the Ridge. And importantly, we're in network for all major insurances, which was something pretty unique in the state when we first opened up.
Yeah, I mean, I cannot underscore that enough. On the physician side, like you, I can't think of the number of times I've had patients come through, prior to my Aware life who needed inpatient, and I really wanted to send them to a quality place. And, it was private pay only, the places that I thought of. So I think just being able to truly accept most people is really notable. The private rooms is also very notable. I mean, I'll say for those listening who are not maybe as intimately involved in healthcare, you think like private room, that's like of course all hospitals should be like that. But rounding on addiction inpatient units, really that is the exception to the rule. Most people have a roommate. And like you said, privacy and autonomy is incredibly important during that detox time. So having your own room really is pretty unusual in a good way. Yeah. And I would say too, the third thing, I think you encapsulated it better, but it's a beautiful setting. I mean, you come around the corner and you're in the mountains and this building that's up on a hill, literally a ridge with beautiful stained glass on the inside. It's easy to find places, addiction treatment centers, I think, that are beautiful. But the question is always, is it beautiful and high quality?
Yeah, right.
Know that, you're in a beautiful location. And to your point, you're getting like top-notch physicians who are in any accredited specialty fellowship programs. Really is great. So that's, I think, what's so special about the Ridge is just, it's beautiful. It's like a private pay environment, accepting commercial insurance with really top-notch quality care.
I can't leave out, I would completely be missing the mark if I didn't point out our staff. And we get really, really strong feedback from people who've gone through our program. Try to put up things that people have said, put them up on our website and advertise, that positive experience that people have. They may contrast it with some other program they've been in before. So I really think we have that secret sauce. I don't know how secret it is, but our staff are knowledgeable and they really care, and they go to the extremes to try and be welcoming and supportive and help out the people and the patients that come to the range. So I didn't want to miss that piece because that's truly what I believe.
And there's so many patients who will avoid care, particularly because they've had really unfortunate experiences with healthcare workers in treating addiction. So to know, hey, you're going to get really top-notch care in a beautiful location with a private room and with staff who are truly empathic and like holding your hand along the way in recovery versus pushing you out the door. You're right. I mean, it really is secret sauce, to success. I'm sure you're so proud of it. It hasn't been open that long, right? I mean,
it's so exciting to be part of it, and it's been open since February of last year.
Yes,
and it makes me proud. Sometimes, I feel I want to take more credit for it.
Yeah,
I want to take the credit for it, but it's not mine to have. But to be affiliated and associated, like with Hartford Healthcare in general, in the state of Connecticut, Hartford Healthcare has been growing and providing great services. Yeah. And to be affiliated with it, my wife was bugging me the other day. I have all of these T-shirts from our events and our runs and the golf tournaments and so forth, and our overdose awareness event we do every year. And I wear them when I go out and exercise and stuff. And my wife says, "Do you have anything else to wear?" And I'm happy to wear this.
Yeah, that's wonderful. Decked out for every event in the most important gear. Well, I want to switch gears and talk a little bit about vaping and nicotine. You've spoken at events in the media about the rise in vaping, and it's complex because for some people in recovery, nicotine is still a part of daily life. What's your perspective, particularly with vaping and even with the rise of nicotine pouches? That's the new kid on the block.
The Zins and other brands.
Yes, the Zins and the Ons. What's your perspective on how, and maybe it's unfair to group both of those in the same category, nicotine delivery devices?
In one way, it may not be fair. In another way, I think it is fair. As a child and adolescent psychiatrist and being an expert in addictions, I know that it's not kids who generally die from drug overdoses, opioid overdoses. It's people who are a couple decades further along, but it's in childhood that you develop the addiction. That's when you catch the addiction, right? And you've heard, the data that's been around for a very long time. 90% of adults who have a substance use disorder started using an addictive substance before they were 18, 96% before they were 21, an addictive substance. And nicotine is an addictive substance, however you get it. If you vape it, then maybe you're going to wreck your lungs too. But becoming addicted when your brain is not fully developed, it really primes you for a vulnerability and a risk that you don't have if you're not using. And we've been unsuccessful in stopping kids from using any kind of addictive substance at all, though I think it still continues to be worth the effort. But kids do, they seek out novelty and, social media and all kinds of different ways things are promoted. And I still do, but I used to talk a lot about how these companies, use the flavors that green apple. I mean, who's using green apple? Well, a kid, as opposed to an adult who initially these products, these vapes, these electronic nicotine delivery systems were the sort of presented as this is to treat cigarette addiction to cigarettes. This is to treat. And although, more recent data shows there are certain ways that they can be used effectively to help some people with a nicotine addiction or with tobacco use disorder, the majority of these things were being pushed to a much younger population who weren't smoking cigarettes at all.
Right. Nicotine naive. Yeah.
The nicotine naive folks. And, we saw the largest in the Monitoring the Future, a study that's done, comes out of Ann Arbor every year, looks at adolescent and young adult substance use, saw the biggest increase in any addictive substance back in 2018 in vaping. It was like 75% increase, unheard of. The next year, the second largest increase ever, and it was in vaping cannabis. So it's a tool to addict your future clients. The future people who are going to have substance use disorders. And if you want to sell cigarettes, let's start with vapes. Maybe talking big tobacco kind of thing. So kids get addicted to something, primes their brain. They're more vulnerable when they get older. That's generally how I talk about it. And you say, the complicated piece is we have adults who smoke cigarettes, are addicted to tobacco and alcohol and opioid. They have these other addictions too. And we were part of the movement that said, look, here's this data. This is the problem with just looking at data. Here's this data that says if you stop smoking cigarettes and drinking at the same time, maybe in some type of a program, it decreases your risk of returning to drinking by 20%. That's incredible. Mm-hmm. However, if someone doesn't come to your program because you don't allow smoking, you've missed them completely. And how many people is that? And, we had a big discussion before we opened the Ridge and back and forth. I was on the side of, no, we are not going to allow smoking. Smoking is an addiction. And look at the data I have here. And then the side of, some of our recovery coaches and some of our clinicians, some people with lived experience. And they said, I didn't go to a program because I couldn't smoke there. I didn't go. And if you're addicted to opioids, you end up dying because you couldn't have a smoke break. So that's the more complicated piece for me. And we do allow it, and we try to also offer a nicotine cessation, tobacco cessation treatment and support and so forth. And we certainly use medications like nicotine replacement medications and prescribed medications, like the partial agonists, to try and help people who want to stop. But we decided we don't want to limit access to crucial treatment program because of smoking.
And I think that's the right call. There's a large center I used to be affiliated with here in Virginia that did a study on the most common reason for AMA, against medical advice discharges, on their detox unit. And by far and away, it was the smoking issue. I mean, even slapping a nicotine patch on folks, they'd get a day or two in and say, I'm out of here.
How embarrassing, right? How embarrassing for us, for the medical leaders. When you hear that, you see that.
Yeah. So I think the Ridge made the right call, because this institution in particular changed their policy after they looked at that data and said, gosh, does it really matter if somebody's not smoking, if they're not going to stay and be able to be detoxed safely? So tough stuff, but I think you guys made the right call. Let's talk about technology. So, there's so much that's evolved in terms of sobriety. There's Sober Curious, where people are just exploring, like, do I want to stop drinking? I've heard California sober before. And at the same time, there's more and more technology that's coming out that's helping people to moderate or modulate or watch their own intake, whether it be wearable devices, whether it be these tiny little portable breathalyzers. You've spoken about this at conferences. And how do you see just AI in general, be it through wearables or other devices, shaping the future of behavioral health and addiction from both the patient perspective and the clinician perspective?
Yeah, we'll leave out the singularity discussion and just talk about AI and innovation. So we started off the conversation talking about having experience with Aware. First time I came across Aware and thought, wow, I want to know exactly what they're doing. I want to be part of this. Similarly, different types of, we can talk about AI, you can talk about other apps, wearable devices, and so forth. And we at Rushford got involved early on in working with a technology company out of Canada who came to us and said, hey, can we help you with anything? And I think they had some idea when they first came to us, but what we were talking about was we run all these programs. We have the full continuum of care for substance use disorder treatment. Mm-hmm. We have a partial hospital program. We have intensive outpatient. We have medications and so forth. But people generally don't relapse or have problems or struggle when they're sitting in front of us. What happens when they leave? That's what we want. That's what we want help with.
Yeah.
We want to know when someone's struggling, proactively be able to reach out and say, hey, do you want to talk to somebody, or should you come back into the office? And we developed this platform, which included recovery coaches, people with lived experience and some specialized training to work in the medical area, along with our clinicians and our medical providers. And this device, they called it a compassionate tether. That's not what its name was on the market, but it would provide alerts for people that were showing some of the signs of struggling. And how did it get this information? It would ask for, a breakdown, ask 8 questions. Yeah. Are you tired? Are you hungry? Are you taking your medications? Did you go to your appointment? Have you attended your group? And generate an alert for one of the recovery coaches, call and check in. And it really worked very well. It was right around the time, just before COVID, we kicked this off. And then during COVID, oh my gosh, we've got this tool. And we were able to track and communicate and connect with our patients. But you mentioned earlier, it's a complicated environment, and insurance can be helpful. Insurance is helpful, but insurance companies, they could be helpful, but you have to, it's a process, and things need to be resourced and paid for. And we ended up not continuing with that device, despite the fact we put all this time and energy into developing. We used it for a number of years, had some pretty good outcome data. But the things that we were doing then, like the journaling and doing some machine learning and AI on the journaling to identify phrases and things people would write in their journals that would indicate they might be struggling or on the verge of going back to using, or even haven't been taking their medications and so forth, was really, really helpful. And the GPS tracking server, it's being used today by multiple companies. The actual product we worked on has had some morphs and changes, and is still out there too. But a lot of the things that we were using, are being used now. I think that the sweet spot is going to be a mixture of human beings, medical providers, and other experts using both in person and outreach into the community. One of the things Aware does, and AI used however it's going to be used, but with wearable devices, with GPS, with other ways to check your blood pressure, check your pulse, check how you're sleeping, different ways to alert and be able to proactively intervene. I think that's where things are going to go. Just one other thing I wanted to say is, there have been some really cool devices that come up, with cognitive behavioral therapy and coaching, and some with AI, some with maybe not having AI. The problem is coverage, insurance-wise, but also use. And you can come up with you and I, Dr. Grawert, we come up with a really great plan. And if no one's going to use it, it's like people avoiding your wonderful program because you don't allow smoking. So you gotta find something that people are actually going to use and engage with. And I don't think that's a completely AI or a completely machine engineered product. But I think any tool in the bag, the Mary Poppins bag or the Felix the Cat bag, is worth looking at and worth using. And, we use all kinds of different things nowadays, the breathalyzers that attach to your ignition in your car, and along with all the different types of community support groups, sober support groups. I say use it all, or you one of my colleagues, Sam Silverman, used to say, you throw it up on the wall and you see what sticks.
Yes. And the beauty of that is there's so many, to use your metaphor, there's so many walls, and what sticks for one person might not stick for another, but you know what? Having the availability and the ability to see what sticks really is.
You were alluding to harm reduction. I like harm reduction better than saying California sober, but everyone says California sober, and that maybe it's just my thing. I don't know. But decreasing the amount that you drink from, significantly and consistently, plenty of studies show your health, your physical, your emotional, your cognitive functioning, your social functioning improves significantly.
Yes.
So if you want to call it California sober, I'm okay with that.
Yeah. Yeah. Whatever works. Yeah. I think about the wearable industry with SUD. I hope that it evolves like glucose monitoring. So, we know right now, like glucose monitors, yes, they're covered if you have type 1 or type 2 diabetes. They're not covered if you want to just proactively monitor your glucose, maybe in a pre-diabetic way, or even just a healthier eating way. They're not covered, but they're getting cheaper. Similarly, like the wearables for alcohol are getting cheaper. But I hope we get to a day, maybe this is at the risk of sounding Pollyanna, where whether a glucose monitor can be covered by a payer, even if you're not diabetic, but you're trying to change, have that real-time feedback on data to change your eating habits, and where wearable devices for SUD are covered as well. I know we're far from that in the payer space, but boy, wouldn't that be nice?
Wouldn't it be nice? I 100% agree with you. It's kind of like, I don't want to say politics because then everyone thinks I'm going to talk about politics. I'm not. But it's kind of like having a two-term incumbent who only needs to get through those two terms. You have an insurance company who says, well, everybody knows that if you had more controlled or knowledgeable approach to eating sugary foods, drinking alcohol, tobacco, whatever, everybody knows that that's going to improve your health outcomes. But we don't want to pay for it because we're only going to be dealing with you for the next year and a half till you change insurance companies. You go, and so why should we're just going to try to kick it down the road a little bit. That's unfortunate. That's not helpful. And that's one of the things that gets in the way, I think.
Yeah. I love the analogy that if you are not in power and control for a long time, there's decreased incentive to do what might be the right thing for long-term care.
Yeah.
Thank you so much for joining me today and giving your perspective. I really have been looking forward to this for a long time, ever since you said you could come on. I always ask people at the end, is there anything I forgot to ask you, or this just that you didn't mention that you would want our viewers to have a takeaway of? Any final kind of closing thoughts?
I always say something similar to this, which is, whether you have a substance use disorder or whether you're just concerned about your use of addictive substances, understand that this has been experienced by many other people. There are helpful interventions. There are people that can help you. There are professionals that can help you. If you've developed substance use disorder or disease, treatment for that disease is as effective or more effective than a number of other chronic diseases. And you've mentioned diabetes, or COPD or hypertension, better outcomes for substance use disorder. And so I wanted to destigmatize and people that don't come to treatment because they don't allow smoking. Those are the kinds of things. Blind spot, huge blind spot. We want to be welcoming. We want to be supportive. We don't want people to be so ashamed or to think this isn't even worth it because it doesn't work. There are effective treatments, as effective as there are other medical treatments. And this is not a helpless situation if you have a substance use disorder. And there's plenty of ways to help, even if you haven't gone that last step.
I love it. And on that note, if you are local to Connecticut and interested in residential addiction treatment, the Ridge is a great option, and you can contact them. I'm going to say the number at 877-307-4343. And if you're thinking more of an in-home or an outpatient model and Aware sounds like it might be a good fit for you, please give us a call as well. You can reach us at 844-292-7372. On behalf of myself and Dr. Allen, brothers and sisters in the fight for addiction treatment and addiction literacy, thank you so much for listening, and thank you for your time. And until next time, take care.